Fox 61 Morning News begins now.
It could be a difficult conversation, but one that needs to be had. This morning, some advice for senior drivers and when they need to give up their keys. Here with some tips, we are joined by Dr. Margarita Reyes. She joins us, and you are the director of Bristol Hospital's Center for Geriatric Care. Thanks for being here.
Thank you for having me.
Let's start first and foremost. At what age should people consider stopping to drive? And is it a set age or is it dependent on the person?
So everyone ages differently, Amanda, and so there is no arbitrary cutoff age as to when should stop driving. While patient and public safety are of utmost importance, we also have to balance that with the need to keep our senior population as independent as possible for as long as possible. And the fact is, driving is equated not just to independence, but also enjoyment of life. And the loss of one's driver's license can lead not just to dependence, isolation, but also occasionally even depression.
Okay. I mean, we were just talking a little bit before the segment. My grandfather's 93 and is still driving and doing it well. So it's like you said, that age is just a number. It depends on a lot of other factors. Let's talk a little bit about those factors. What are maybe some of the, I don't want to say warning signs, but maybe some things that you should take into consideration when you're thinking about what time to stop?
So certainly drifting into lanes, driving over curbs, stopping unnecessarily or suddenly accelerating. These are just some of the warning signs, but what's most important is to actually look for the pattern of change in one's driving habits or driving abilities and to look at the frequency and the severity of these events.
What should family members do? It's probably a dreaded conversation that they need to have with their loved ones.
So first of all, do not be confrontational. Instead, be respectful. A lot of my elder patients, their complaint is they don't want to be talked at. They don't want to be spoken to like children.
Right.
They want to be respected. And so make sure that you have the conversation in a respectful environment. It's always better to have short, frequent conversations about driving cessation rather than having that one arduous, long talk about it. Second, know that your healthcare providers can be your partner in making this decision about driving cessation and having the conversation. And third, if you're going to talk about it, make sure that you offer concrete alternatives to driving and offer to help with that transition.
When we talk about health, sometimes we do have to consider that dementia can be something that elderly people have to deal with, whether it be from a disease, whether it be from age. What should we do for those people who might be experiencing some of the side effects of dementia?
Okay, so I often get asked that question. Just because someone has dementia, do they automatically have to stop driving? And the answer is no. There are certainly a lot of patients with mild dementia, and I stress mild dementia, who are able to continue driving safely. However, it's important for patients and family members to know that one day, the day will come when you have to give up driving because of the progressive nature of the disease. And us healthcare providers, apart from, of course, doing a physical exam and a cognitive exam, we look for a couple of things. So first, we look for patient insight into their cognitive limitations and the willingness to adjust to these limitations. Self-report of driving ability is actually one of the least reliable indicators to tell us of a patient with dementia and safety driving. And second, we look for family oversight, and by this I mean the availability and willingness of family members to actually get into the car with the patient and report to us healthcare providers if there are any concerns.
All right, Dr. Reyes, thank you so much for being with us this morning and giving us that information. We appreciate it.
My pleasure.
Coming up next for you here on Good Day Connecticut, signed, sealed, delivered. Many college applications